All right, everybody. Can y'all see me okay?
Mhm.
Is there enough light? Oh, okay. Yeah,
There
there's
is.
plenty. All right. Well, so this is a very new way to meet, and
Hold on. It's not quite. Hold on.
okay.
Give it like 2 seconds.
Okay.
I think you're good.
Says we are recording. So first, Catherine, can I just ask you, because I've had people inquire if they can't tune into the live meeting, will there be a way for them to go back and watch after the meeting ends?
Yes, that's correct. I've been recording it since we started, and I will send that out, and it'll also be on our Facebook page.
Okay, that's really good to know.
All
All right. Okay, well, thank you everybody for joining in, and thank you Chief Dixon for being here, and Tony for being here from Denton County Friends of the Family Executive Director. I thank you for taking time out today from your schedules. I know that everyone is busy with new things that are happening in our community. So I wanted to host this or have a way for the community to see us live and talk about the question or the comments that I've been hearing and stories of increased abuse due to the COVID-19. And I was curious about our local statistics just personally, and then I thought that everyone else probably could benefit too and would like to hear our conversation. And so Catherine helped us put this together, and I appreciate that. Thank you so much. So I felt like maybe we could ask, I have a few questions to start with, and then I know the community may have some questions that we will be able to answer too. I think if that's the way it's set up in the chat. Is that correct? Will we be able to do live questions?
Yes, we are monitoring the chat box, and if you hop on Facebook, you can also see the chat box in real time, but we are on it too.
Doing that as well.
Yeah.
Okay, that's good to know. So let's see. So Chief, can you briefly, I know a good way to maybe start the conversation is, can you briefly just go over some data that you have pulled for us recently regarding family violence and the cases here?
Well, I'll tell you, first off, thank you to yourself and Friends of the Family for putting this together. It's a wonderful relationship, I think, that we have with Friends of the Family when you're talking about all the wonderful things that we're doing collaboratively. I just actually got off of a group teleconference with North Texas major city chiefs about 5 minutes ago when we talked about this very thing amongst a lot of others. Here locally, I'm very pleased to tell you that we're about 12 cases down from where we were this time month to month last year. With that being said, the caveat I really want people to be aware of is because those numbers appear on the outside to be down, we don't know what that looks like, because oftentimes we know that survivors of family violence can't report, especially right now when you're all being quarantined or isolated to your home. The different methods for you to report being abused, those have dwindled. Some don't do it out of fear. In the self-isolation right now, they really don't have a lot of mechanisms in which to report it. So I don't want people to get lulled into a false sense of, because we're down 12 cases from the same time month to month of last year, that we don't have a significant increase in it, if that makes sense.
Okay, and
that would be my concern too, is that we know we've seen in March, we saw a 36% increase, and that's pretty much when COVID-19 became pretty prevalent in Denton County. And so in March, we saw a 36% increase in calls to our crisis line. They weren't all necessarily calls requesting shelter. They really were people calling us, trying to find out access to resources, wanting to know what information was available, trying to find out if we were still going to be accessible for them during this crisis, and for people to just try to call in and to process some of the things that were happening, safety planning. And as Chief Dixon was saying, that's one of the biggest concerns is we're seeing the decrease in them calling and actually asking for help from law enforcement. But the concern with that is that people are more isolated and they are not able to have access to their friends. It's also an economic challenge because now there were survivors who were maybe in the process of planning and safety planning to get out, and they had employment, and now they may not have jobs, and so they don't have access to those resources. So those are some of the real barriers and challenges that we know that survivors are experiencing during this really critical time. We last week from the 18th, so the last 2 weeks of the month, we had requests, we had 61 intakes for new people coming into our system. And that's pretty on par for what we see on a monthly basis. That's pretty consistent for us over 2 weeks. We expected to see that go down a little bit just because it was a shift in having to make that adjustment to go to video conferencing and doing information over the telephone for survivors, but really people still called in, completed those intakes because people want to have access to information. They want to be able to get mostly a lot of calls about their legal rights and kind of what is available for them.
Okay, and so I want to get us on the same page because Chief Dixon is specifically talking about the city of Denton police calls, and when you say 61 intakes, is that throughout the county, or
those are the intakes that we're seeing at Friends of the Family. So
okay.
They could certainly be people from anywhere in our community, anywhere in Denton County that are calling. Yes, absolutely.
Okay, and so I appreciate you mentioning that and taking the calls. And the question is it possible the reporting would go down? And you already answered that with yes. And is there a number of people that can text? So is there a number where people can text to make it more private if they need help rather than make a phone call?
We don't have text capability yet, but it's one of the things that we're exploring and look at maybe in the next week that should be available. But we do realize that kind of in this extended, in this quarantine period, that, yeah, it's going to be more accessible for people to be able to reach us online, which we do get messages through our Facebook at times, but also to be able to do it. One of the biggest things really is that she's not having an opportunity to have any space to get away from him. Before was an opportunity to go to the store or to go take the kids to school or to check in with a friend. So kind of some of those built-in safety measures that were available for survivors before, those things are currently not available.
Okay. And Chief, is that a concern for our PD department?
It absolutely is. And I will tell you that if someone feels like they're in immediate crisis and they need police assistance, you can always text the 911 and we will dispatch and respond in the same manner. But the longer that we stay in this stay-at-home posture because of the pandemic, the concern, not with just myself, but with my fellow peer chiefs, is that people are getting more and more agitated. You're looking at just family stressors are going up. People don't know if they're going to have jobs when this is over. You've got kids being homeschooled in many instances. So now you're juggling schooling your kids, trying to provide for them, and you don't know if you're going to have the means to do that in the next 30, 60, 90 days. So the stressors, alcohol sales across the country are up like 225%. So there's just so many different things going into play right now. It really has us concerned for the safety and well-being of everybody.
Well, I have a question here in regards to that about financial strains and pressures, if that is an increase. And Tony, you may answer that. Do you think that has something to do with the increase in new intakes that you're getting?
Well, I think that what we have to remember is that while the proximity, while the financial stressors, while all of those things may be additional stressors in these households, they may be contributing factors, but at the root of it, the basic issue is power and control. And so we can't lose sight of that, because if we lose sight of it being about power and control, then we forget in the times when we don't have all of these, when COVID-19 is over, we forget that domestic violence still exists. Because the basic root is that one person believes they have the right and the privilege to utilize power and control over their significant partner or their intimate partner. So the financial issues absolutely are additional stressors on an already strained situation. But also one of the things to look at, for instance, we have a client that has been seen by our legal team who she departed her batter in the last quarter of 2019 and has been moved out and is trying to maintain her safety. We've been helping her with her legal measures. But one of the things that's happened is now with the stimulus plan coming through, they did file joint. They filed married because they were still at the end of the year, right? The money that was deposited for their income tax return was deposited in his account. And now the stimulus plan, just 3 children. So she should receive $2,700, but in reality, that money is going to go to the account where they file their taxes. So she's living separately, trying to manage. He's not providing her much financial support, and she has 3 children. So the stimulus money that's coming down, that would greatly alleviate her situation. Now those dollars are going to be deposited into his account. So our legal team is working with her on what legal remedies we can help her to be able to engage in order to get those funds where they rightfully belong. So it's a very complicated situation. So yes, will the finances absolutely play a part on it? Will the financials in this circumstances, be a barrier for her being able to leave? Absolutely. And then for women who have left, the stimulus money that is designed in order to support and help them, then they may not have access to it.
Okay. And so Chief, has there been an increase, and I know I didn't ask you this ahead of time, but maybe you'll know, of arrest with drug and alcohol issues? And do you think that there's a correlation there with violence?
So we have not had an increase in arrest with alcohol-related incidences.
Mhm.
Of course, again, you start talking about, we're still arresting people for DWI. So clearly, folks are still out on the road and driving under the influence. We are still arresting people for public intoxication when other means to resolve that has fallen to the side, meaning they don't have someone that they can release this party to. They're being aggressive or assaultive or whatever other mitigating circumstance that is. So absolutely.
And Tony, I just want to go back to something you said earlier about power and control. And it is finances, and there could be alcohol usage, but do you think that these are the people who are in the most trouble were already experiencing some sort of violence in the home, or do you think that these are brand new cases of individuals experiencing violence?
I would think that they really were already homes that were experiencing violence or some level of control in the homes. And perhaps this proximity and the quarantine certainly may escalate an already difficult situation. I don't know that we have seen anything that says, oh, before there was never any use of power and control. There was never any physical, emotional, or sexual violence, and then it escalated just because of the quarantine. I think that's probably unrealistic. The reality is there were homes already experiencing these issues, mm-hmm. and that this has just been one more stressor in already strained home environment.
Okay, yes. Chief, I want to ask you a question. I saw that we have a few more questions coming in, but in the community and around nationally and around the state, there's been mention of releasing some offenders. And do assaults or domestic violence abusers fit into that release category? And is that a concern for Denton County Friends of the Family, or our police departments as well?
I'll tell you, it's absolutely a concern of mine, as well as the other chiefs, not just locally, but throughout the state. There's a push right now in Harris County, for instance, to release thousands of what they're deeming to be nonviolent offenders because of this pandemic. Chiefs are reaching out to the federal courts down there And we are expressing our concern that you can't make a broad sweep or a broad brush and say that we need to release all these folks that we're deeming nonviolent, which will put some of these abusers back into their homes with these families. And I say that's to say this, that, it's a very complex issue. We understand we have to try to keep everyone safe. Even those that are incarcerated, they're still human beings, they have rights. But we need to have a very thoughtful conversation on what are we doing to those homes when we're sending abusers back into it. And we're having those families that now they have a shrinkage of avenues to get out of that position they're in, and how can we keep them safe at the same time while balancing public health.
So
So,
Keely, can I add one thing clarified? While
Yeah.
Friends of the Family does not have a text hotline, the national hotline does. And so it's 22522. People can text to that, and we'll make sure. Katie, can you put that in the underneath this Facebook Live? So 22522, people may text, and that's the national hotline, and then they can make a phone call. The national hotline will certainly connect with us on a local level or wherever the caller is texting from.
okay, that's good to know. And did you have any comments about the question that I asked the chief on releases or?
Well, I think one of our concerns is that sometimes DV is maybe misunderstood and maybe misidentified in those cases. So sometimes it may come up as a property crime because they may go over and may vandalize or kick in her door or something of that nature. And maybe it's not identified as a domestic violence issue. It's maybe identified as a property crime. And so sometimes we see those people released with a really low bond. So they get out pretty quickly, and then they're not subjected to an emergency protective order because they were not held as a family violence crime, if that makes sense.
It does. There's just a lot of levels of complexity.
Right. So it's it's like if the crime is committed, but it's not identified properly, then there are all of these kind of natural things that will kick into the system if it's identified properly. But if it's not, then we are back at looking at it as a property crime. That's the way it's written up. And then we don't have the other legal remedies available to get protection for her.
Okay, and I just want to, because we have, I've heard the Child Advocacy Center talk about, child abuse. And so when we're talking about domestic violence calls and cases, are they intertwined with child abuse cases, or is this completely separate?
We do see a lot of child abuse cases, of course. CAC is going to handle those that are specifically, but they're going to also see those cases where it has been that the child maybe has been sexually abused, but then also CPS has put the responsibility on the mom to be protective of the child. But in delving further, then they find out that the dad is also abusing the mom. And so then it may get referred to us as a family violence or a domestic violence case. But definitely there's going to be a high level, the intersection of domestic violence and child abuse, of course, is very, very high. We see that very consistently throughout our business on a daily basis. And we have programs that are advanced program that is specifically for identifying and addressing those parents where there has been domestic violence, where the mom has been abused, and where there has been child abuse, and trying to help to identify that intersection and how it can be most effective in helping her to be able to be safe, but also have her have access to services, and so she can maintain custody of her children as well.
And Chief, do you have anything to add to that on how the police department responds to the different cases? Or I know, again, I didn't ask you to look into any of the data on the child abuse, just the domestic violence, but have you, or is there an increase of calls for that?
Well, I'll tell you the same thing that kind of Tony said. These two intersect one another very easily. Child abuse happens in the home sometimes, where there are also instances of domestic violence. So the intersection of the two, they blend very well. I think we work well with both the Children's Advocacy Center of Dane County as well as Friends of the Family to try to mitigate those and cross-connect resources when we can.
In our program, we're going to provide counseling to children that are witnessing domestic violence, And sometimes for children who have they have also been subjected to domestic violence or to physical abuse or sexual abuse, they may make an outcry that has not been founded. One of the biggest challenges is that even if they've gone through the CPS system and perhaps there was some child abuse that was reported, maybe it was not founded, or when they go to court, the batterer still has access to the child even when the mom has left. Maybe there's supervised visitation, or perhaps he's worked through supervised visitation and now he has access to those children. Well, the children are still coming to us for counseling because it's in some of those cases, they're going to be re-traumatized every first, third, and fifth weekend for standard visitation. So we saw over 700 children last year. They weren't just children who witnessed domestic violence, they were children who experienced some violence towards themselves as well.
And so we have a question here, since we're talking about children with disabilities are very much at risk of abuse at this time. How can we help these children? And I know that I have seen, generally when children are out at school or with friends, there's signs that teachers or counselors can pick up on, and as they're quarantined, there's not. Is there anything, Chief or Tony, that we can give to our community on how we can help these children?
Well, I'll tell you, because some school districts have switched to online virtual classrooms now. We're asking teachers to just keep an eye out on your kids. You know them very well because you're with them every day, right? So while you're having these virtual classrooms, pay attention to them and their demeanors. If you see something out of sorts, please let us know. Reach out either through your district or straight to 911 or our non-emergency line. There's a number of methods out there for you to get in contact with us so we can follow up. You know, the one thing that we want to make sure of is we're doing everything we can and we're not overlooking anything that could lead to someone being injured or worse in this time.
Okay.
Yeah, I think I absolutely agree with Chief Dixon. That's one of the concerns we all had, is that we know when with school being out, children lose access to a lot of safe people in their lives that they don't have access to during this quarantine. But yet the teachers are still interacting with them online. The school district has certainly been out providing meal service. And so there is that face-to-face opportunity that the people who are delivering meals are going to be able to see the kids. The children have to be there in order for the meal to be distributed. And we are certainly have made ourselves available to school teachers and to counselors at the various schools where we would normally be providing prevention education awareness programming. Then our team has reached out to them, and we're certainly willing to help them with, let's look at some tips, let's look at things that you can do in order to make sure that those kids still know that you're a safe person that you can talk to, and that they have the opportunity, maybe brief moments. And for, in our stores, people are still going to the stores, our grocery store workers, our cashier, our clerks, for all those people who are still out there that are having access to the public. I would just encourage people that if you see something, say something. That is better, safer to make a report or to call some attention to something you believe that is of concern than to say nothing. Because who would want to walk away from it and for something to happen to someone's child and we fail to say something? There's no harm in saying something, just to identify that particularly there is a risk there. And it is left up to the authorities to be able to determine that.
And when we talk about authorities, I know, Chief, when I went on a ride along, you have a very thorough, the officers do when they witness or they feel like family violence is part of something that they're witnessing or rolling up on. They have forms and they fill out and numbers to call. Has there been any changes in the department on the way that you handle these calls since the COVID, or has everything been pretty consistent?
No, absolutely. We are staying consistent, especially when you're talking about crimes of violence, whether that's child abuse, DV, sex assaults, robberies, aggravated assaults. We're out here to serve the community, and we're not going to stop that. And I can tell you that the men and women of the Denton Police Department, they're still out there doing their job every day, like they were prior to the pandemic, and they're going to continue to do that.
And you talk about the men and women on the police force. Just why I have you here, is there is there anything that you are doing or your officers are doing during this time of stress and change for during the COVID-19 for your officers mentally, or is there breaks or training or anything that y'all are doing to make sure that you're taking care of yourselves out on the streets?
Absolutely. We are looking after them. We have a very robust peer support team that's working closely with the fire department, our other peer agencies in this area to look after our officers, especially those that have to spend time at home because they're being quarantined. That can be a very traumatic experience for anybody. But when you're in a public safety sector, if you're a firefighter or a police officer that has to stay home for 14 days because of a possible exposure, that can really be damaging to you mentally. So we're keeping track of them. Additionally, we have kept our gyms open internally. So if they want to come work out, that's a great stress reliever. We're doing the mandatory temperature testing when they come in the door to either go to work or to work out, just come in the building. So we're trying to do everything that we can, send them resources. They can call if they need additional help. We're just doing everything we can at this point to make sure that we're looking out for them.
Okay.
And I think, Keely, with your question about is law and DPD doing anything different with domestic violence calls, DPD has been our champion in that they have consistently, for the last, I believe, 3 years, we implemented the fatality assessment. And so that is conducted on a family violence call. And if that victim scores a high enough score where it is the lethality is predicted, then it's a high risk case, then they're going to the patrol is going to call our crisis line at Friends of the Family with the victim immediately. And so that officer doesn't leave the scene without having the victim to be able to talk to someone on the crisis line. And either if the victim's seeking to be able to come into shelter or just seeking services or needs more information about protective order or whatever it may be. So that is still in existence, correct, Chief?
Yeah, absolutely is.
And I'm glad you mentioned
it. May be even in this times that maybe we can find a way to even escalate it. Perhaps we want to do it more frequently than those that are scoring at a high lethality assessment could be one of the options as well. We're certainly prepared to be able to take those additional calls.
Okay, that's good to know. And you did bring up the shelter, and there's a couple of questions here about the shelter.
Sure.
Are you at capacity, and are you still accepting individuals into the shelter right now?
We are still accepting individuals into the shelter. Absolutely. We have, I believe 26 was the census today in shelter, and we will still be able to take additional people. We did have to move, and we have the capacity to be able to move people to hotels if we need to. We do have a secured hotel that works with us. And if we need that additional bed space, we can certainly do that. So if there is someone who needs help, they don't need to worry about our capacity. We are operating hashtag we are here, and we are working 24 hours a day, 7 days a week still. And we've just had to modify some of our abilities, some of our methods, but we are still working and able to, definitely shelter is available.
Okay, and we heard the chief talking about, different things that they had to do for their department to keep them safe and quarantining. There's a question here about, is there anything with the COVID-19 that you're doing differently to keep your individuals in the shelter safe?
Yes, so we have to practice, of course, we're practicing social distancing as much as possible in the shelter. We did have a family that we had to have tested. And so they were definitely isolated to one particular room in the shelter that they could use. And then we're doing extensive cleaning. We have staff and our facility staff that's also going over to clean up the shelter on a regular basis, doing it periodically throughout the day. And we also have temperature. We're doing temperature checks and logging those, just trying to be really conscientious. We've also streamlined our shelter staff. We're on a skeleton crew there, so we have fewer people coming in and out of the shelter. So fewer people working, and then for the most part, we have the rest of our staff. People think of Friends of the Family as a shelter. It is one of our programs, but we have a staff of nearly 80, and most of those work in our non-residential services. And so for the most part, most people are working remotely. We do have a small number of people that are coming into the office. We are not accepting people in the office currently into our non-residential offices. everything is done over the phone. We have had some court accompaniment that has still occurred, and we're certainly available to do that. And we are still writing protective orders. The courts are working with us on those things and getting them through. So it's been a trying situation for everyone, but I think all entities are now, I feel like everyone's in a position where people are kind of, the systems are starting to work now in our new normal that we're experiencing.
Okay, and there was a question here about what the shelter needs and how can people help. If you guys could, under this link, put up a list of what you need and how we can help. And Chief, maybe you guys could do the same thing. If you're asking for special supplies or ways the community can help the department. I know there's a lot of people out there that just want to do what they can and help. And I have a few more questions here. And so we did talk about the if in the food line, when someone is serving food, how can someone be more aware of how to potentially spot signs of abuse? What are our community members looking for? And either of you have answers to that question.
Well, I think if you're talking about child abuse, then I think those are very different. If you're looking at domestic violence, then pretty much it's up to her to make that outcry. When your family or friends are talking to you and he's saying that she's saying he acts very differently, or he's doing these things, he never hits me, but he pushes me or shoves me, or he slams the door, or he blocks my doorways. I think those subtle things that are very oppressive physically, people are oftentimes waiting for, in domestic violence, they're waiting to hear someone say he strangled me, he slapped me, he shot me. And I want for people to be more receptive to when someone says, when a family member or a friend or a coworker says, I don't feel safe to be able to talk to my husband like this. Or when they say things like, what are the rules? One of the things that we commonly will ask clients, well, what are some of the rules in your house? And she will have a whole list of rules. Well, for those people that are in relationships that are not violent, there are not typically a lot of rules. My husband and I have a basic respectful agreements in our relationship, but we don't have rules. There aren't things I get in trouble for in my home. Okay. So that's a big sign, those type of language things. When you're looking at children, of course, you're looking at if a child makes an outcry or if they say something to you, but children can be shy in nature, and that may not be an indication of child abuse. So sometimes we're just waiting for clear signs that are very evident that that people are able to use their voice. The biggest thing is when someone uses their voice, whether it be an adult or a child, that we listen and we don't discount people's voice. That's the biggest thing.
Okay. Chief, do you have anything to add to that?
Yeah, I think absolutely. When people are not in this type of abusive relationship, they assume that the signs that they're going to see are going to be very outward. They're going to see signs of injury. They're going to be very depressed or sullen or sad. The fact of the matter is, and Tony just spoke about it, oftentimes until someone makes an outcry, you're not even going to know. So if you do have a child that's kind of withdrawn or shy or standing really close to their mom or dad in the food line, you may not be able to link it directly to abuse or domestic violence. So, you just have to keep your eyes open. If you see something you think's out of place, let someone know. And then if it turns out that it's nothing, all the better. But we have to be very cautious on that.
And on domestic violence calls, do those calls usually come from neighbors and someone else out in the community, or from within the home, police, for the police?
Many times we'll get a phone call from a neighbor saying that there's a loud fight going on, things are being broken, things are, I hear someone being thrown against the wall, or there's some outward sign, right? So we'll go there, and typically, if he or she doesn't feel like they're in the position to make their outcry, then they'll try to mitigate first. And when the mitigation doesn't work, then they switch to kind of denial. And then they'll kind of take up for the person. And then, it's a process of getting them to a point where they feel comfortable making their outcry and getting out of that position. But, again, people that are not in it, very quick to judge. And it's not as simple as saying, I no longer want to be in this abusive relationship and I want to get out and I want to leave. Because there's so many other intersecting things here. Finances, emotional support, that's my child's father or mother. There's just a litany of things that people take for granted.
And I see we had another question here we answered earlier about an increase or decrease in people reaching out for help during COVID-19. And I would say, just to reiterate, that the actual calls have decreased in the city of Denton, but for Denton County Friends of the Family, they have increased. Is that correct?
I think we've been seeing we did see an increase in March. Overall, we saw that 36% increase in our crisis line calls. Absolutely. And I think just with people being afraid, not knowing what to expect and kind of processing, where can we get help and what's going to happen? And maybe they were in the midst of, I think it was really big when people heard that the courts were closing down, because if they were in the midst of a waiting for a hearing or something that was supposed to happen for them in the judicial system, and then not knowing what to expect, what was going to happen. Because there are a lot of things. The court system provides a great deal of long-term legal remedies and protections for victims. And so hearing that was not going to be available, those were some really, really scary things for clients.
And here's a community comment for Chief Dixon. It's not necessarily about the family violence, but it says policing does not stop because of COVID-19, which we're well aware. It's concerning to read that so much has been put on hold. Where we live, we're not safe. Talking about shootings, and the people involved have not been evicted and processed as should be. That would be something maybe you want to comment on if you want to say a
Sure.
brief comment on what you guys are continuing to do during the COVID-19.
Police officers have not stopped policing the city of Denton. Let me be clear. Police officers are out. They're still making arrests every day. We have detectives that are still investigating crimes, filing charges, and arresting people every day. The police department is not in charge of evicting people from their homes, removing them from apartment complexes. We are charged with public safety, keeping people safe. Now, when you talk about shootings going on in the city, there's a process that we must go through. We have to interview people. We have to get witness statements. We have to make sure that we can corroborate things before we put someone in jail. Taking away someone's freedom, we can't take that lightly. And it's not as simple as you see on the TV shows that there's a shooting, you go out, people point to the bad guy confesses, and we put him in jail. So I want to make sure that people understand we are not stopping policing activities in the city. Detectives are still filing charges. We're still arresting people, and that's not going to change.
Okay, thank you for that comment. And we have another question about red flags. And so I think probably Denton County Friends of the Family, if you have something, you can also post under here so that people can have a reference to look back to at another day if they're feeling like there's something.
Sure. Well, absolutely. We'll post the red flags, and we'll post the needs list for the shelter right now.
Okay. And this one is, how can someone receive your services if they cannot leave the home?
Then they can call us, and still the same number, and the crisis line number will be listed under here. They can call the crisis line, and they can still come get access to services. We are doing intakes and counseling and advocacy, as well as legal consults. We're doing all of those by phone now or by video conferencing.
And if somebody is feeling threatened or like they're in an extremely dangerous situation, is it best to call Denton County Friends of the Family, or Chief, would it be best to call 911?
I'll answer that. If it's imminent, they need to call 911. Absolutely. And let's let our local law enforcement do their job, and they'll do it very well to come out, and then they will be happy to connect them with us.
Okay.
Absolutely.
We don't want to get in the way of his work at all, do we, Chief?
Right. Well, I know that there were some different changes, and sometimes people aren't sure when to call 911 and when not to. And so I think it would be great for people to know when to place calls and who to call.
Yeah, I think anytime there's some imminent danger, people feel like there's harm pending, then they should call 911.
They should call.
Absolutely.
Okay. All right, and there's lots of other community resources. There's information. I know that there's a lot of mental health issues going on in our community.
Absolutely.
And there's CASA and there's a lot of other community organizations that individuals can reach out to. And so I appreciate y'all taking the time out here and meeting with us. This has been really helpful for me as well, and I hope for the community members. I don't see any other questions coming in per se right now, but if y'all either have, if you want to say something before we sign off, just feel free.
I would just like to say thank you for reaching out to us and wanting to set up an opportunity for the community to have more discussions and information related to how they can help survivors and families experiencing domestic violence. And certainly thank you, Chief Dixon, for being such a great partner for Friends of the Family. We are mostly importantly want people to know that we're still here. We're doing services 24 hours a day, 7 days a week. And so we are essential to this community, and we will continue to be here and doing the work. And if there's other ways that we can help, then people just need to reach out to us to let us know. And there was a brief time where the hospitals were not letting us come for the sexual assault responses. But I believe something came out yesterday that changed that. So now we will be able to go back and do that. So, but mostly importantly, just that people know they can still call the crisis line for help, or they can reach out to us on social media if they need to. And certainly they can text the national hotline if they are in need. So
I'm sorry, you just brought up another question or a statement that came to me. So if Chief, someone is arrested in a family violence situation and they've been physically hurt, are they allowed to go to the hospital at this point in time?
If the person that is arrested has been hurt?
Well, I mean, the person who has not been arrested.
Absolutely.
Anyone, if you've come into a situation and they've been abused, there's physical violence, you can transport them to the hospital still.
So officers will ask if they want medical attention there at the scene. We call Denton Fire Rescue that will come out. Paramedics will assess them and then offer to transport them if appropriate. So
COVID-19 has not affected those kind of transports in any way?
No, it didn't. In fact, Denton Fire Rescue has done a wonderful job of dedicating resources just for COVID-related responses. And so they have not changed their plan at all.
Okay, thank you. And I'm going to let you wrap up with a little, if something you have to say, but there is another thing that came in as far as Spanish-speaking families. What resources does the Denton PD or Denton County Friends of the Family do you put out for Spanish-speaking families?
We do. We have Spanish-speaking staff throughout our agency on the crisis line. We can connect people directly with Spanish-speaking staff. So we are fully bilingual, and we also have lots of materials, all of our materials and intakes, and we have booklets and information booklets that are available, and they're all in Spanish. And so if someone has a particular need, if they'll leave a message there on the Facebook, then we will be happy to connect them with a particular staff person who can connect with them. If they have a group they want to speak to, we can do that in Spanish at all different levels. So those are certainly greatly accessible for us.
And is it the same with you, Chief?
Yeah, same thing for the police department. We have Spanish-speaking staff here on hand, including investigators. Both of our victim service counselors are both fluent Spanish speakers, and they can connect them to resources locally and regionally.
Okay, thank you. And I see a note here that this video, they're going to work and try to work and translate this video too, which I appreciate very much. Your staff's been very helpful in organizing this, and we're learning about the technology here. And so I appreciate everything that you guys both bring to our community, and for joining us today. And Chief, did you want to say a little something before we head off, or are you good?
You know, I think right now is just a time for us to continue to come together as a community and a society. This is one of the worst times in our modern history, and it really is going to tell our story later on how we continue to treat one another. just ask the people take care of those that can't take care of themselves. If you can help a neighbor get groceries or supplies, please reach out and do that. This is a time for kindness, not for hate. So just love one another.
Very sad. Definitely everyone be safe and stay well.
Yeah, I know the isolation is difficult for all of us, and my heart aches for those who are going through family violence situations who are stuck in that isolation. And I know that people that have tuned in just want to know, how they can help if anything. And I feel like we've gotten a lot of good information out here. So thank you all for joining in and tuning in today. And maybe if, we're still in situations and if there's increase in calls or, there's another message you need to get out to the community, we can meet again like this.
Absolutely.
Absolutely.
All right. Thank you,
Thank you.
everyone.
All
Thank
right.
you.
Thank
Stay
you.
safe.
Bye.
Thank you.